Hi everyone, and welcome to a new episode of Cracking Allergy.
Today's topic is how to detect allergies and know which allergen you are allergic. There are several tests to discover what are the patient's allergies. You will have an interview with the allergist about your symptoms, your environment, and your medical history. It allows for restricting the number of tests that will be performed. It is important to check with your doctor if your current treatment don't affect the test results. For example, taking antihistamine treatment a few days before the test can impact the results. The most common test is the prick test. Your skin is exposed to suspected allergic-causing substances and is observed for signs of an allergic reaction. This kind of test can detect allergy to the most common allergens. In practice, a drop of allergen extract is placed on your skin. It is often on the arm or the back. The allergist will insert the product into the skin with a thin needle. After 15 to 20 minutes, you can observe on your skin an itchy and red or pink zone around the point where the drop was placed. The spot has to be measured and compared to a negative control to determine if it is a positive result. The doctor will often keep you under supervision for an additional 15 minutes to be sure everything is okay. The results will be analyzed by the allergist taking into account your medical history and answers given during the interview. Indeed, you can sometimes obtain false positive or false negative with prick tests. The expertise of the allergist is thus necessary to interpret the results. The cutaneous test is cheap, rapidly explores up to 30 allergens, and clearly shows to the patient the nature of the allergic reaction induced in some minutes by this test on the skin. For example, a cutaneous reaction to a cat will demonstrate the reality of the responsibility of this allergen. This is the first step to a successful eviction of this pet. On the other hand, is concerned the whole allergen and not the different components. The different allergen components are now key parameters for exploring the potential risk of exposure to this allergen and also indicating immunotherapy. This can be achieved using blood-specific IgE. Another way to detect allergy is through blood tests. As we saw in the last episode of Cracking Allergy, allergic persons have specific IgE in their blood that recognize the allergen they are allergic to. Blood tests that try to detect this specific IgE. They are recommended especially if the person has a violent allergic reaction or to confirm unclear prick test results. There are multiple possible blood tests with different methods, characteristics, precision, and efficiency. The most common ones are the ELISA test, the immunocap test, and tests on biochips. They are performed using mainly purified allergens. Now, you know almost everything about testing allergies. Watch the next episode of Cracking Allergies.